we go. Now for some people, they've had cosmetic surgery to make the nostrils a little bit narrower. We call that alar base reduction as the medical term, or just nostril width reduction. So there could be some fine stitches down here kind of hidden where the nostril kind of joins the cheek and upper lip. Really the concept of cleaning those is exactly the same. We're going to use Q-tips dipped in hydrogen peroxide. The same concept, we want to bubble off any kind of that yucky, kind of dried, bloody stuff. So take your moist Q-tips. One thing about these stitches, they're fairly prickly, so you want to be careful. You don't want to get the cotton from the Q-tip sort of stuck on the stitches, so clean them with a little bit of, shall we say, high attention to detail. So you're getting the dried blood off, but you don't want to get any little cotton wispies kind of stuck in those blue stitches if you can avoid it. So it's the same sort of three-step process. Step one is the moistened Q-tip with hydrogen peroxide. Step two is kind of, for lack of a more sophisticated word, kind of mopping up that little brown liquid that forms. You can see on the Q-tip how there's that kind of little bit of brown liquid. That's just kind of the dried blood being kind of washed away. And the third step is to apply a little ointment. At home you're going to have a tube of ointment. In the medical office we kind of have these individual packets of antibiotic ointment, but it's all the same. You just want to take a little smear. You can see that I say it's like the size of maybe a small yellow kernel of corn, just to kind of give you an idea of how much. And just kind of lay it along the stitches. Nice and easy. Again, don't let the cotton fuzz don't let that get caught in the blue stitches. And just kind of keep a thin smear of that ointment right on top of the stitches. A good rule for all facial plastic surgery procedures, nose, anything, keep all your incisions out of the sun. If sun were to hit this in the early phase of healing, it'll make it red and pink, which will eventually go away, but it'll be there for a lot longer. So avoid the sun, clean it maybe 2 or 3 times a day, keep all the kind of yucky dried blood off of there, put a fine layer of ointment. We will typically take the stitches out about 7 days post-op, and then you'll be good to go.